Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
I love to tell this story, Cathy, because early on when Joe Steckler was first getting Helping Seniors going, and Jennifer and I were talking about this on the radio, it's hard to imagine that this is now going into 15 years. 15 years of serving the community. This is after Joe built up Brevard Alzheimer's and got everything going with the Joe's Clubs. But he said there's more work that needs to be done because people need to find out where resources are that are going to help them. And one of the very first TV shows that Joe did, he says, I want to do TV so I can educate seniors and their families about things they need to know. One of the first people he called was Cathy Rowlands, who has incredible background of knowing things, everything from executive director of a different kind of skilled nursing. She's got all that background, years of experience in home health, guardianship. I mean, I can't even begin to talk about all the things. So I won't. Let me just bring Cathy up, and she's going to share with us today on things we want to think about for long-term care. So, ladies and gentlemen, Cathy Rowlands.
Yeah, well, my background is different. I was a biomedical researcher for many years. I worked my way from the state of Oregon. Was in Utah. I was in Texas, and I finally ended up ending that career in Rhode Island. And that's where I got involved in long-term care. Is one of my extracurricular activities. I got into an organization that had an elderly lady who lived in a nursing home, Talkwatton Home for women only. And that's how I got my start. I helped her, and I got involved in Ecology Action for Rhode Island, petition for bicycle routes through Providence. So that's how I really got started. And my husband wanted to retire, and he told me I was too young for a job, too young to quit. I needed to get a job. So I was hired by what now is called Rockledge Health and Rehab. It was called Sunny Pines. That's when I took it over. And I lasted for about 11 months because I walked into 41 deficiencies and I brought it down to 15 in 11 months. Yes, I did work hard, and I read about care management and in the Wall Street Journal. So that's how I got started. I went to the West Stan and I went to Phoenix, Arizona to their national conference, and I met everybody. And I learned my trade on the West Coast, not here, because I was the only one at the time that was interested in doing that. So that is my little background. When should you start to think about long-term care? Most people, and if you read the articles, you should start thinking about it as you end your retirement, maybe 50, 60 years of age. Because as we all know, it's very expensive. And also, I think around that age, you should start examining some of your family history. Because I've found, too, that individuals that live a long time have ancestors that do live a long time. I'm taking care of a lady now that's 93, or she will be 93 first part of February. And her mother lived to be 99, and she's still functioning probably 50 to 75% of the time, but she's able to live alone with a couple hours of care in the morning and a couple hours of care in the evening. So you got to think about it. Who is going to pay for it? Well, my recommendation is that at that age, you should probably have a financial planner or know somebody that you can talk to, figure out how your assets can be arranged so that they'll continue to grow and you'll have at least enough to take care of yourself for a while based on your family history of how long you're going to live. I mean, because most of it, the plans, long-term care insurance, the plans, you could buy that, and that's what I did. And I guess I was around in my late 50s, early 60s. I bought long-term care insurance because having run the nursing homes, knowing what Medicaid provides for you, it scared me. And I bought it for both my husband and myself because I have no intention of hopefully going into a facility. I like my home, I like my privacy, and I like being able to have my animals. So, most of us are going to need assistance of some type as we age. I don't think, or mature, as I like to call it. When considering the various levels of long-term care, you need to assess what the care needs are and weigh the options that are available to help you with that, with those care needs. Most of us are going to need, as I said, need this assistance. So, what is long-term care? Personal assistance of services for daily living. The first is the instrumental activities of daily living: assistance with laundry, finances, shopping, housekeeping, transportation, and meal preparation. And that's where, I mean, you can think about it at that point in time seriously if you need it. And that's where this lady that I have, she needs finances. She can do her own laundry. She can't shop. She thinks she can do her housekeeping. She can make her bed. She can't do that. And she does have a housekeeper. She can't drive. And meal preparation is she can make her own sandwiches and pull something out of the cupboard to eat. But her family has orders Meals on Wheels. I'm not Meals on Wheels, Mom's Meals, and that seems to work. The son was ordering the same ones every time, but I got hold of the list, and we have a little variety, and they do have fairly good meals there. What is the long-term care service continuum? And that starts at home-based. And that's where you could have home companions or CNAs. And the average cost of this, according to the internet, is $25 to $30 an hour. Companions, Meals on Wheels, and monitoring services can help you with that. And that's what, with this lady, I put cameras in the house. There's cameras in the kitchen, cameras in the bedroom, and there was a camera in the living room. But I think she got into it and somebody did. Nobody's fessing up to the problem with it. But we do have at least the two cameras, and they're monitored by her one son in Phoenix, one son in Virginia, and myself periodically. But the kids do most of it. Then there's community-based adult care, which varies about $70 a day. They say that is 20 to 30% higher for specialized care, dementia, which, having been involved in that before, that's where I met Joe Steckler the first time when I was running Rockledge Health and Rehab. My grand plan was to they were going to expand it, and it was an H shape. They were going to have another unit added onto the building, make one unit the Medicaid unit, and make it the Medicare and then dementia. So people could go back and forth, and the other have the non-dependent individuals. But you would think I had 5 heads, so that didn't go very well. But Joe did help us come up, and I tried to set up programs for the people that had dementia. Then there's institutional based, which we have the hospitals, and then we have the skilled nursing facilities. I bring the skilled nursing facilities are $9,000 a month to $10,000 a month. $9,000 for a private, for a semi-private, $10,000 for a private room. And I know I had a client that I was paying $11,000 a month for a nursing home here a few years ago. So it's very, very expensive. And that was plus he had caregivers twice a day on top of it to get the care that the family wanted him to have. The assisted livings are $2,350 to $5,600 a month. And that is probably not dementia care in a dementia unit. It probably goes up another $1,000 because of the staffing and that is needed in a dementia unit. But that buys you a room and it buys you 3 meals a day, somebody to give you medicine. And I don't know what happens if you need showers and stuff like that. Most of my clients would have a private aide come in to do that. Then, just a minute, where am I now? Okay. So then there's the continuing care retirement communities. Like Buena Vida is one of them, and that's been here a long, long time. I don't know whether it still requires a significant down payment in the $30,000 to $40,000, and then you pay by the month, and it's expensive. I have a lawyer friend of mine that she tells me, Cathy, you should move here, move here. Well, she moved up there and she's in the independent and she won't come out because she doesn't want to sit with the gray haired ladies. And, you know, so everybody has their own issues, but she's paying big time for her one room and to spend. And she does have a caregiver that comes in twice a week to take her to the store, get her out, walk her, and that kind of thing. So, I mean, you got to do something. So, who pays for this care? Home-based is private pay. Okay, long-term care insurance might be an option, but they have their restrictions on what qualifies you for the nurse to come in. So, Medicare only comes in for therapy. And I guess you can get some medical care, but it's short-lived. And you can get it, I think you can get it renewed once a year if you need it for the therapy. But you've got to go to the doctor, get the orders and all that. For skilled nursing facility, Medicare comes in and pays for the first 20 days in the nursing home. After that, if you don't have a secondary insurance, you're out. It's private pay. Or if you have the secondary, it goes to 30 days. And a lot of people figure that Medicare will pay for 100 days. But that's only if you're on a feeding tube, a ventilator, something that requires skilled nursing. You couldn't get that any other place. So remember, it's 30 days and you got to make another plan or pay the nursing home. Assisted living is private pay for the most part. And there's the big facilities, and some of them will not take Medicaid. They will take aid and attendance from the VA, but they won't take Medicaid. The facilities that do, and I couldn't figure this out when I first came, why Medicaid stopped at the nursing home. The federal government's contribution stopped at the nursing home, and that's because we don't pay taxes here. So that's finally when I came, and they had small group homes, and one of them on over 192 by the movie house over there in the back, Florida Shores. That was written up in Consumers Reports many years ago. It was started by a woman in here, and it's been going on for a long time, but it's still the advantage of these small group homes, most of them will take Medicaid if they can meet the requirements for Medicaid. And for some people, I really like the small group homes, especially if somebody has dementia of any sort. Because people, and if you stick them into a big group, there's too much stimulus for them, and some people just don't do well on that. But some of the small group homes are well run, and I tell people if I recommend anything, I get on the state surveys website and look at what their surveys are. I think that's important to when you're evaluating a facility, and it gives you something to ask them if there was a sighting, and you can't hold anybody, because most of the time if something happens like that, there it is cleaned up. But see what kind of answer you get from them. So the bottom line, you need private resources. Some Medicaid, but there's Medicaid programs. There's a Medicaid needy program for over 65, blind or disabled. There's income dependent. There's Medicare, there's long-term care insurance, and there's VA aid and attendance. But all of these take a lot of planning and effort to get on the program. And Medicaid, you can get on a list. They put you on a list. And I don't know what the list is, probably 6,000? It's probably 6,000 people on the list. And you get a call and they bump you up if something changes with your client, that they end up in the hospital or something. You need to call them up and get them bumped up, because the list is long and it can take forever to get onto Medicaid. Florida offers 6 programs for seniors who are not eligible for Medicaid, which can provide services, support, and financial, and for the elder care. These encompass the optional state supplemental OSS program, a monetary grant for individuals in residential care, Project Relief, which offers free respite care, Alzheimer's Disease Initiative, lending support to Alzheimer patients and their families. There's the community care for the elderly, and then there's home care for the elderly. Key reasons for long-term care services: you're discharged from the hospital or rehab center. And usually it could be up to a month to get yourself back on your feet again. Alzheimer's or dementia diagnosis. Most people, it's hard to deal with these people because all of them are different in where their brain has been atrophied and their functional status. So it's difficult. You need round-the-clock care, and your spouse or partner is no longer able to provide the needed support. And lastly, for you wanting to go into long-term care, to move out of your home, would be a change in your lifestyle, to move into a senior community like Buena Vita or some of the others. Some people, like my friend, that's what she wanted to do. So you could do what you want to do. And if you can afford it, by all means, do it. So, but the most important things to be able to think about is if you go to the hospital and you're discharged, what would be your plan? I mean, you need to think about that. Most likely it is that if you get 3 days, 72 hours in the hospital in a Medicare bed, not a examination bed. Don't let them do that. They like to do that, the hospitals, because they can test you up the yin-yang and make money. So you've got to be in a Medicare bed 72 hours, and then they'll put you into a nursing home. So you have to think of that. So the key elements of long-term care planning, first of all, are the legal documents. You need a living will, Probably a do not resuscitate if that's your wish. A healthcare surrogate, a power of attorney, maybe a pre-need guardian or a guardianship. But in order to do this, you need to consult with an elder lawyer. And I looked at the list here, and we do have attorneys that do it. So this is the all-in-one, one-stop shop. So I think that's very important. You don't want to do guardianship, and you don't want to let things get to that point. It's expensive. You can't even, its initial cost is about $20,000 because you have to pay for your attorney, the ward's attorney, the examining committee. So you don't want to do that. So get your, and also if you're elderly and you've drafted a living will and you do not want to be resuscitated, you need to get from your physician that yellow piece of paper, the do not resuscitate paper that goes on your refrigerator. And that means that, you know, if they find you, and I've had several clients that they didn't do that, and by the time they find them, they have to try everything they can do to bring them back. And if they do come back, I had a friend that brought someone and somebody brought back, and they went on for about 6 months in a coma. So you got to think about that. You need to think about the resources. Where are they? And first of all, is talk. If you don't have a financial planner, then maybe you need to get one, or talk to an insurance broker. And both of those are on our list here, that people that you can contact. And long-term care insurance is good. Don't forget that it has a waiting period, usually about a month. And and you've got to meet certain qualifications in order for it to kick in, like anything else. Fortunately, I bought it. My husband and I bought it, and when he fell and broke his hip, and a broken hip is a one-way ticket. No matter what you think, it happens that you end up in the hospital, and that's what happened to him. But with our long-term care insurance, I kept him home till he passed. And so I really think that the insurance is a good way to go if you can get the right one and if you can afford it. And the last but not least, I want to suggest is care management, calling somebody after you've got your plans together, and maybe initiate contact with somebody that's a care manager. We have a 2 or 3 here, can't remember, including myself. We'll give a free initial consultation to let you know what we do and what you need to look for. And so then when you can feel free to give us a call when you do need the help. So I can't think of, do I have any questions? Yes, sir.
Yes. Been to Moose Haven in Jacksonville, and they'll take care of you. You just turn over whatever income
Come in there. Okay.
in, and they'll take care of you. So that's another option a lot of people have never heard of.
I haven't really, I've heard of it, but I didn't realize that it was what you had to do.
You can buy in like some of these other communities.
Yeah.
If you want to have a separate place and you have money, but if you don't have money and hadn't planned, that's another wonderful option.
Does it get filled up where you have to wait to get in?
You have to be recommended by your Moose Lodge, and there might be some kind of waiting list. We're continually building more facilities up there.
Wow. Okay. That's good to know. That's good to know because there's very few of those around. And there's also aid and attend. If you've been in the military, there's aid and attendance, which, and unfortunately, you got to be, the veteran has to be in some period of conflict that they define. Used to be pretty clear, but now it's World War I, World War II, the Korean War, the Vietnam War, the Gulf War, and that includes Operation Desert Shield and Desert Storm. And then it also includes Operation Enduring Freedom, Freedom Sentinel in Afghanistan, Operation of Iraq, and the Operation of Inherent Resolve. That's in another Islamic state. So that's good to know, because some of these veterans that come back from that, because it used to be World War II, Korean, and Vietnam. But I got online, last night, and I couldn't believe how many they've added, which is good. But there is a protocol that you have to go through for that. And that's another thing that people need to be aware of. Save your DD 214, some safe place, because that's what you need. I have a client, I'm trying to settle his estate. Unfortunately, when we went back to Social Security, his mother, when he was born, instead of giving him his father's name, gave him her new lover's last name. How she could do that, I don't know. Well, when I went back to Social Security, I found out when he was 18 that he did went to Social Security and changed his name to Smith, which was his original name. Well, then he was in the military, and his name was his mother's person that she was living with. And apparently they supposedly started for adoption process in California, but you can't get into those records once they're closed. So it's very difficult. But keep your records and stuff like that. It's very, very important. And I just want to say that Seniors Helping Seniors, the list of helpful people here are pretty much what you need. And it's a good start to select somebody from these groups.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.